The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, Innovative Approaches to Engaging the Public Sector. This webinar is the first of the 2019 ASPPH Presents series, which has been designed as a service to CEPH-accredited ASPPH member schools and programs of public health. This webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. All registrants will receive an email with a link to the posted recording and slides when they are available. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note: while you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the chat or question box. We will address your questions at the end of the presentation. And as a reminder, this is the learning objective for today. And I am happy to hand it over to our first two featured speakers, Drs. Keisha Pollock-Porter and Joshua Sharfstein from Johns Hopkins Bloomberg School of Public Health.
Great. Good afternoon, everyone. Thank you so much for being here with us. We're going to go ahead and jump right in to share with you today our experiences engaging the public sector and telling you about what our faculty and our students have been doing here at the Johns Hopkins Bloomberg School of Public Health. As Sarah mentioned, I'll be presenting here with Dr. Joshua Sharfstein, who's a professor of the practice and vice dean for public health practice and community engagement at the School of Public Health. And I am, as Sarah said, Keisha Pollock-Porter, the professor and director of the school's Institute for Health and Social Policy.
And this is Josh. It's great to be here. And as we go through these different options, we'll be commenting a bit on the work that we've done with other schools of public health and the opportunities for other schools and programs of public health to do similar kinds of programs to engage with the public sector.
Great, thanks, Josh. And we'll have some guests joining us throughout our time together. So we'll just go ahead and get started with the next slide. So we just wanted to start by setting the stage to just state the obvious, which pretty much is that faculty at schools and programs of public health are teaching and conducting outstanding research on major public health challenges. And it's important to publish important peer-reviewed papers from this work, but also a lot of us are driven by the desire to actually have an impact on public health. And so there's a main challenge that we are all continuing to face, which is that our health departments and other public agencies are responsible for addressing these major challenges. So we have researchers in schools and programs of public health who are conducting the research, and we have practitioners out in the world who are actually addressing these major health problems. And we have a question then is, well, how do we actually bridge academic practice and the public sector to address these leading public health challenges? And what we're going to do today is talk through a number of these strategies. And we're going to tell you about how we have three main approaches that we're going to emphasize. One is how we share our students and faculty with the public sector. The second we're going to tell you about are a number of mechanisms by which we support faculty translating the results and disseminating the results to the public sector. And we're going to talk about our practice of consultation and really the importance of consulting early and often.
So we're going to jump into the first area for collaboration between the public sector and academic public health, and that is to share students. And by sharing students, we really mean more than just a bulletin board of here's where you go to maybe try to find an internship. The idea is to set up a program supervised by faculty at the School of Public Health to place multiple students across a health department or health departments in a structured way that is really meeting the needs of the health department as well as giving great opportunities to the students. And we have a program here at the school called the PHASE Internship Program. We put a whole bunch of students both at the State of Maryland Health Department and the City of Baltimore Health Department. And you can see on this slide a picture of one of our students presenting at the end of this formal program. There are presentations to some of the leaders of the state health department, and you can see the wide range of activities that were done last year through this, including analyzing local health improvement coalitions, hoping for the best while preparing for the worst, about disaster preparedness, determining the health education needs of seniors in Baltimore City. So these were all projects that were mainly defined by the teams at the health departments. And so this is something that engages with the senior leadership at the health department. They get their staff to put together great ideas for projects. They know when it's coming every year. We have an enormous number of students who are applying for these. It's actually competitive. And then they get placed there and they get to do their practicum, for example, through this work. We're joined here by Palani Mui, who oversees this process for us here at Johns Hopkins. Palani, anything you wanted to mention about the PHASE program?
Hi, everyone. Thanks for letting me join in on this. I would say Josh covered pretty much everything, but it's a great way for students to get engaged with different sorts, not only the health department, but also the Maryland General Assembly, and to get a sense for how to apply what they're learning in the classroom to work in the actual public health practice. And so this year we have 16 students who are joining us for this.
Great. And so you mentioned the Maryland General Assembly. So there are other opportunities, both through this and outside of this, particularly for elected representatives to work with students. And one of the pictures we have here is from a class, actually, that was one of the members of the General Assembly happens to be on our faculty. And he did a class with some of our faculty, including, I think, you, and where he posed specific questions to students, and the students worked in teams to answer those questions that are relevant for health policy to be made in the state of Maryland. And in addition to that, we have a fellow who's worked with the City Council on specific health legislation. And anything that you want to mention about that class or the process of providing specific technical assistance to legislators?
Sure. So students in the course, as you mentioned, work on pressing policy topics that actually the senator, who is a faculty on in our school, actually identifies. So this year he identified things like prescription drug pricing, e-cigarettes, mental health screening, and also looking at the opioids. And so these are all topics that he thinks are priorities for the upcoming session, which dovetails well because they start in January. And so the work that the students do in December and that they present on can then be utilized by the Maryland General Assembly for the upcoming session.
Great. And anything, Dr. Porter, to mention about the City Council program?
Yeah, just another great opportunity. Through the Bloomberg American Health Initiative, we have an opportunity called the Policy Change Fellow, which is a competitive application process where our students were able to select an experience to work with one of our local city council members. And when I think about the student who just completed her time last year, she had a range of experiences. She went door to door and canvassed and met with constituents. She helped to conduct background research to help support legislation that the city councilman was working on. So again, similar to the PHASE opportunities that Palani just talked about, we're able to connect students with legislators and to help them meet the needs. Again, they're often understaffed, and so the students provide a valuable resource.
And so a theme of this with students is it's not just about individual students doing projects, it's about the relationship that the school has with the agencies, which is then strengthened by the work that the students are doing and can increase and expand over time. We're now going to, I'll just pause for a second to say that if you have questions about anything that we're saying now, you can just enter them in right there and in the webinar chat function and question function, and we will have some time at the end for questions. But now I'm going to move on to sharing faculty. And so there are certainly a number of schools of public health and programs of public health where a particular faculty member may be on the public health department staff or leadership, as well as a professor or an instructor at the School of Public Health. We're talking about something a little bit different, although that is a great model. This is about actually the School of Public Health supports a particular needed function at the health department with faculty member who is really as part of her faculty time, is actually doing the work of the health department. And we're joined with the Baltimore City Health Department's chief epidemiologist, Dr. Darcy Phelan-Emmerich, who's an assistant scientist here at the school. Thanks for coming, Darcy.
Thanks so much for having me.
So we're looking on this slide where we can see a whole bunch of the projects that you work on at the health department. Maybe do you want to pick one to tell us about, maybe this big map here?
Sure. So in 2017, the Baltimore City Health Department released its third iteration of what we call our neighborhood health profiles. And these are customized profiles that we make for all the neighborhoods in Baltimore City. And we cover over 60 different indicators of health and the social determinants of health.
So maybe give a couple examples.
So for example, we calculate things like infant mortality rate. We look at overall age-adjusted rates for the top causes of death in the city. So heart disease, cancer, stroke. We also look at deaths that are related to drug and alcohol use. In terms of our social determinants of health, we look at the housing environment, measures of the built environment, for instance, like vacant lot density. We also look at the educational environment within the neighborhood.
And all of those reports have data just for that neighborhood?
Yes. Yep. So for each of our 55 neighborhoods in Baltimore City, each has a customized report with 60 customized indicators for each of the 55 neighborhoods.
And the history of this report, this is on like the third iteration of
Yep.
this, and what you've done is amazing. The history of this is one of the first, if not the first, reports within a city to look at life expectancy disparities across the city. Those have gotten pretty common,
Right.
but the first one I think was in Baltimore.
Right, and when the first iteration of the neighborhood health profiles came out in 2008, it was documented that there was a 20-year difference in life expectancy between neighborhoods in Baltimore City.
So how do you do 55 reports like this?
Very carefully. So in order to do the reports, we had to download a lot of data, and I actually had a student work with me, a phase student from the program that you discussed earlier. The student worked with me to download the publicly available census data and to aggregate that by the 55 neighborhoods. She also helped with calculations of some of the health indicators and played a really big role too in helping to do a landscape analysis, taking a look at what other cities have done. You know, this was our third iteration of the neighborhood health profiles, but we wanted to expand and see what other cities had done and what we could do to improve upon.
So in part, you are the human manifestation of that bridge.
Yes.
That we showed on the previous slide. And, you know, besides bringing students in to work on interesting projects like these neighborhood profiles, what are the other things that you do to bridge the public health school and the public health department?
So I also work with faculty, and we have faculty that approach me and the health department sometimes with a project in mind. They know that they want to focus on maternal health, for instance. But we've also had faculty approach us and say, you know, we're here to help. What kinds of things are you interested in learning about? How can we help you? And so, and working both of those ways has really helped us improve our technical ability, you know, to have resources from faculty that want to work with us. And it really helps us to view the school as a resource for doing good work at the health department. You know, most local health departments are under-resourced. You know, not enough staff, not enough money, not enough time. And so being able to utilize these students and also work with faculty has really helped things at the health department.
And, you know, I think the school's investment in you as a bridge has really paid off for all these different connections.
Yeah, I'm going into finishing up my 4th year in this role, and I really have seen the level of collaboration increase. I know right now, I'm working with 2 phase students, but we definitely have 4 or 5 students working with us, and also have a couple different projects going with faculty members here.
Great. Thanks so much.
So we're going to shift to talking about sort of our second bucket of topics we wanted to cover today, and that is around translating results. And as Josh mentioned earlier, in terms of other schools and programs of public health that are involved in these activities, I know that many faculty are engaging with policymakers and decision makers. They're translating their results to help inform policymaking and decision making. And we have a couple of specific ways that we do that at the school, and I'll give you a few examples. The first is the Lipids Public Health Policy Faculty Awards. And this is a program that we are really excited about that is made possible by the support of Roger Lipids, one of the school's donors. And through this award, it really grew out of a recognition by Roger that faculty are doing a lot of great research, and he wanted to support helping them get the information out to decision makers and recognizing that a lot of federal funding or foundation funding doesn't really support this work. And he also recognized that there's a need to get money into the hands of faculty to do this work pretty quickly. So every year we have 3 deadlines, and we are committed to, through a competitive process, we identify a recipient, and within a month after the call or the deadline, we award those funds to that faculty member. So that way they can get out there and work on a policy project that some person outside of the school, a policymaker, decision maker, has requested. We are really excited for these projects because they emphasize projects that support the translation of research into policy action and also the direct support of policy development. So for example, we might have somebody who's conducting really important research to help inform a legislation or regulation that might come up at the city, state, or national level. Part of what's unique for these awards is that there's a requirement that the faculty member engage a decision maker or a policymaker as what we call a principal knowledge user in support of those efforts. So you have to have a letter of support from that person, for example. You have to talk about how you're going to work with them to translate research. We also require students be part of these awards as well to provide additional valuable experience to students in translating research into policy and practice. I'm really excited today that we have one of our current recipients with us, Dr. Keith Nachman, who's an assistant professor in the Department of Environmental Health and Engineering at the school, and who received a Lipids Award to work with the Baltimore City Office of Sustainability on urban agricultural issues. So Keith, thanks for joining us today.
Keisha, thanks so much for having me.
Can you begin by just briefly telling us about your project and about how the Lipids Award supports your ability to translate research to policy?
Absolutely. So I'm the PI on a project called the Safe Urban Harvest Study, which is focused on exposures to soil contaminants incurred by urban farmers and gardeners here in Baltimore. Excuse me. Our research grew out of a partnership we've had for a long time with the Baltimore City Office of Sustainability and a handful of other local urban agriculture support groups like the Farm Alliance of Baltimore City. And it entails gathering information about the practices and the behaviors of urban farmers and gardeners. And it also involves sampling growing area soils, irrigation water, and urban grown produce for toxic heavy metal contaminants. We're also collecting produce from the grocery store and farmers markets for comparison.
Great, thank you. So you mentioned that there was a partnership you had with the office for a long time. Can you tell us how exactly this research question or your project came about? How did it develop?
Sure. I worked with the city about 6 or 7 years ago to help them develop an initial soil safety policy and kind of review some numbers they put together for lead, arsenic, and other contaminants. And we sort of maintained that relationship over the years as they thought about doing different things with how they allowed people to use land in the city. And they really came to us last 3 years and said, we need help developing actual data in the city for soil contamination to help advise people on how to proceed in terms of whether or not it's safe to garden. So that's how we kind of fostered the beginning of the study.
So when they came to you and said, we need help, you could have easily said, all right, let's go ahead and write this NIH application, and a year from now we can get funding, or some other long period of time if you were that fortunate. talk to us about how these funds and the way that they're organized has really helped you to translate your work and to work with the city.
Mm-hmm. We were really happy to get the Lipids support because it served as a formal mechanism for us to engage our government partners to help craft public health policy in the domain of urban ag that's really adequately protective but not overly restrictive to the point that it might deter participation in urban ag. I mean, what we're going to be doing is taking the findings from Safe Urban Harvest and working directly with the city to go back to that soil safety policy that we developed years ago without any empirical evidence in the city, and actually use what we found to help shape, we understand how farmers and gardeners behave, and we understand the rate of contact with soils. How can we set standards that really let them flourish and do what they do safely? In the initial plan for our research, our translation activities were really just focused on reporting back to the participants and maybe to a limited extent the city. But what Lipids is now allowing us to do is really go further with that translation and set us up to pursue the creation of materials that the city can share and possibly even co-brand with people who want to get started with urban agriculture. Specifically, what Lipids is allowing us to do is translate what we've found and also some best practices for farmers and gardeners into online and printed materials that the city can use to share with new folks, and it's going to let us create a couple of videos that people can download and just see, how can I build a raised bed? How would I interpret results of soil testing in order to make sure that I feel confident that I can do what I'm doing safely?
Great, thank you, Keevan. Thank you for those great examples of about how the city approached you guys and you were able to leverage these funds to really provide the types of information that's going to advance the practice and how the office is really approaching these issues.
Sure.
Great, thank you for that example.
Yeah.
One other example I want to mention is really sort of dovetails nicely off of what Key was mentioning regarding dissemination. Another initiative we have at the school through the Bloomberg American Health Initiative is something called the Dissemination Awards. And this came about because of a recognition that many research studies are funded and people sort of stop with writing the papers, and they oftentimes don't have support to disseminate research to the end users. And so with the help from the initiative, we are giving out annual awards between $10,000 and $20,000, really to say, how do we get evidence in a usable form and share it widely? So the emphasis here is only on recently completed research, though. So we're talking about research that's been done within the last sort of 6 months or so, and we're supporting investigators to develop briefs, websites, videos, infographics, and we're actually monitoring the reach because we think that this is a really great way to say, let's get our evidence out there. The two images on the slide, the one in the middle is actually a really exciting new online resource that was developed through this award around protecting public health in a changing climate. And the recipients of the Dissemination Award developed a new online MOOC that's really targeting city, local, and regional officials around climate change. The image on the right is another document that was recently completed, which is around how do we advance a public health approach to reducing sexual assault on college campuses. And so really excited for these two activities and thankful for this particular type of funding at the school to help, again, emphasize dissemination part of translation dissemination research.
Thanks, and maybe I could ask you a question because you work with many faculty who are doing this sort of thing. How does this differ from a traditional grant? I mean, why isn't this sort of included in the normal grants that faculty get?
Yeah, great question, Josh. Thank you. So I will say that we came up with this award because faculty were telling us that the grants or the funding that they have oftentimes don't include these dollars for these particular products, right? So they might have enough support to evaluate their initiative, publish the paper, but they don't have resources to create an infographic, to buy the visuals, to work with the designer, to actually create something that's visually appealing, that can help to synthesize and translate the findings in a way that audiences can reach.
So this is sort of like the last mile problem.
Absolutely, absolutely.
For policy.
Yep.
Great.
Well said. Thank you.
So we're now going to move to the third bucket that we're talking about here in bridging between the public sector and academic public health, and that has to do with consultation. And what we mean by consultation here is a more formal kind of engagement between faculty at schools and the public sector to provide help, really, in addressing some of these big challenges that the public sector deals with. I used to be a city health commissioner here in Baltimore, and I woke up every morning feeling responsible for all these things that were going on. And in general, the people in the public sector do feel responsible. They feel responsible for infant mortality, for urban agriculture, for overdose deaths, all these different things that are happening. And this is sort of a way, a little bit, to share that responsibility, to say, we want the insight and the guidance from people who are experts in the field to really help. And so we have been trying to facilitate that in different ways. And typically when our school at Johns Hopkins gets involved, if it's a project that's not directly in the area, we will work with the local schools and programs of public health for their faculty to be the lead, and we will provide support to them. So for example, in Rhode Island, where the state has one of the highest overdose rates, the new governor at the time, Governor Raimondo, hold on one second, the new governor actually wanted help from academic public health in thinking about the overdose crisis. And we worked with a fantastic group of faculty at Brown University, led by Dr. Jody Rich and Dr. Tracy Green. And they had a team at Brown with some support from here at Johns Hopkins. And they had created a small group that worked with a larger task force of a broad range of people in Rhode Island to think through what would be the opportunities to really make progress on the opioid epidemic. And you can see on the right here, some of these are actual headlines from Rhode Island newspapers, that she created the task force, that it held a public forum, that it focused on access to medication. It actually, this process, the recommendations that Dr. Rich and Dr. Green came up with, one of the major recommendations was to add treatment with medications to the jail and prison in Rhode Island. And when they did that, they actually found a 60% decline in overdose deaths among people leaving detention. That finding, which you may read sometimes about Rhode Island, really came out of a process that was a bridge between the state governor's office and the Brown University School of Public Health. Here's another example from not too far away from Rhode Island, in Staten Island, where in 2017, the Office of the Borough President was particularly concerned about opioid overdoses. That at the time they had the highest rate of drug overdose deaths in New York City. And one of the questions that the Borough President asked was, looking out at all the different activities going on in Staten Island, how do we know we're focused on the right things? And so we at Johns Hopkins found some fantastic local experts, and they're really national experts who are based in New York, who came together to work with the Borough President's Office to develop a strategy to find specific, they called them North Star measures, the most important things that the various efforts across Staten Island could align to. And this was led by a number of faculty, particularly Mark Gravich from New York University, Chinazzo Cunningham from the Albert Einstein School of Medicine, and Nora Santiago from the College of Staten Island. And we are lucky today to have joining us Isaac Gorodetsky, who was the person in the office of the Borough President's Office really charged with making this process work. So Isaac, are you with us?
I am.
Are you in Staten Island right now?
I am indeed on Staten Island.
Okay, excellent. So thanks so much for joining us. And I just wanted to, ask you, of all the different things to think about on opioids, why was it, what was your thinking behind this? What was the Borough President Otto's thinking about this? And why engage with academic experts?
Sure. Well, as you said, we on Staten Island have the highest rate of overdose deaths in the state. In 2016, that rate was 32.5 deaths per 100,000 residents, and that mobilized a large-scale effort on the ground. And there were efforts across the island by many groups to make a difference. And we would meet regularly with those groups to figure out what more could be done. And the borough president, James Otto, he quickly realized that we really didn't have a way of measuring our impact. And despite all of the investment and all of the great work by on-the-ground entities and first responders, there was really no way for us to understand what more needed to be done, what was working and what wasn't. And so we looked to Rhode Island to figure out what they were doing, and we were lucky enough to have you and your team at Johns Hopkins School of Public Health come forward and offer us a proven model to essentially create a data strategy, but much more than that, really to identify for us what we should be paying attention to make sure that everyone on the ground was rowing in the same direction. And through that process, we all got on the same page. You emphasized to us how important it was very early on from the beginning to get the public involved, to include all of the stakeholders at the same time, to get the expertise of those national prominent academics to really filter through all of the feedback we were getting from the public and get it down to the core measures, which we hope to publish very soon.
Great. Thank you so much for joining. And I wonder, when you were thinking about working with academics, were you worried that it would just take too long? I mean, like, what's the reason you think you don't see this as much as you might otherwise? Like, how did you, I remember some of the initial conversations about, could this really be, done in a relatively short period of time? How did you think about that?
Sure. I think the most common barrier, I don't want to speak for everyone in government, especially New York City, but the most common barrier that we see here in working with academics is that a lot of times the suggestions or recommendations that we get aren't really realistic given the rules and regulations and politics that are involved in addressing any issue, including something as pressing as the opioid epidemic. Just with data, for example, there are privacy issues and a host of barriers in collecting the information that is most necessary to figure out whether or not you're making an impact on the ground. But really, it's this, I guess, prejudice, you could say, of academics not being able to come down from their ivory towers to come up with solutions that are actually realistically implementable and can go through the political process. And I think that was the difference between what the School of Public Health at Johns Hopkins brought to the table. They, for example, already did this work in West Virginia and Rhode Island. So there was a model that has went through all of the testing grounds that also experienced a very high rate of overdose deaths, but also understood the political realities, understood again that it was necessary to engage the public, and that was what made us comfortable. It became clear that this was not going to be just an effort that was published in an academic journal. It was going to be something real.
Well, thank you. Appreciate that. And I think you're bringing out a really important point, which is just because a public sector entity is going to turn for expertise to an academic center or school doesn't, excuse it or from really doing a serious public engagement. And in fact, in all these places, including Rhode Island and Staten Island, and as you said, West Virginia, really having a public engagement strategy has actually been part of the engagement of the academic experts. In all those places, the academic experts have met with many people from the public, and it's a meeting of, the people who are most affected by the issue with the people who know a lot about the evidence, and you really see greater understanding on both sides when that happens. But it really takes a forward-thinking political leader like the borough president and a great staff like you, Isaac, to really make that a reality. So we really thank you. And I think Isaac's going to stick around for questions, so people could put in questions for you and for our other guests as well. So as we're getting closer to wrapping up, I just also want to mention that we have a program here at the school, in part based on the success of some of the projects that we've done around opioids, to support a faculty member 100 hours of their time to do a consultation project with a public sector entity. And we have some initial projects, one related to food policy, not agriculture policy, but food policy in Baltimore. Another related to maternal mortality in New Jersey. And the third related to employment opportunities for people in recovery from opioid addiction in West Virginia. That's a project I think that involves a number of the businesses there trying to bridge between the city, the business community, and the treatment community to really help as many people thrive in recovery as possible. And so on all of these, just like the program that Dr. Pollock-Porter mentioned, we get a letter of request from the entity basically saying that, you know, they'd like our help. Faculty are free to figure out what they want to do and what's possible. And we have a process, again, competitive, I'm going to come back to that, you know, to be able to award the money up to 100 hours of their time. And, you know, to come back to the competitive part, something as I've been listening is that a lot of these opportunities for students and faculty particularly are done on a competitive basis, in part because, you know, we're not just tapping someone and saying, you need to do this as part of your job. We really want people to want to do it. We want them to see it there, you know, they see value in it. And we will provide support to them, but we really want them to own the projects. And that, I think, is one of the reasons that people are so highly motivated to actually do them. Anything you want to mention on that, Dr. Pollock-Porter?
That's great. I will ask you, though, a follow-up, Dr. Sharfstein, in terms of this particular award. When I talk to people about this program, they say, you know, that's so unique. Why do this when, you know, don't you think faculty might do this anyway? Or can you talk a little bit about the motivation for the 100 hours of consultation time? And again, faculty at other schools say that this is so unique and they really appreciate having these resources for faculty to be able to do consultation.
Well, you know, in most schools, either you're getting paid through your teaching or you're getting paid through research, and there really isn't, everything else is extra. You know, and I think the idea here is that there is so much value to the information and the knowledge that exists within schools and programs of public health that could be shared. And if there's a great opportunity to support sharing it, it's a relatively small amount of money for potentially a huge impact. And the kinds of projects that people are doing, really, it could be quite impactful for people around the country. We're hopeful that what this does is helps people who are faculty members think a little bit differently about their job, that there's this other opportunity that isn't just an extra, you know? I mean, I think you're right that there are some people who do this anyway. This is what they do as an extra, and it's something that's very important to them. I think with this, we're hoping to dip a little deeper into the faculty, to people who have really translatable knowledge and understanding, and have them have an impact as well. And over time, really shift the idea of what it means to be on faculty in terms of the ability to impact policy. And let me just say that coincident with this is, you know, a program to really recognize excellence in public health practice as part of the academic advancement process at the school. So just to conclude, there are many opportunities to build a bridge between academic practice and the real world of public health. We've certainly found that many students, staff, and faculty at our school and others are eager for opportunities to make a difference in their own communities based on their knowledge, and the most successful projects involve early engagement with the public sector and really joint development of ideas and programs. So with that, I think we will conclude our presentation, and maybe we'll have a chance to take some of your questions. Thanks so much to Sarah and Rita and the
Unmuted.
ASPPH for the opportunity to do this webinar, and we're certainly available, I think, for questions.
Thank you, Josh and Keisha, and all of our speakers today. I want to remind everyone that they can submit their questions via the question box, and we'll start addressing them now. First question. What portion of the salary for the, in quotations, bridge epidemiologist who works with the health department does the school support, and is the person an employee of the school or the health department?
We have the person right here.
Yeah, I'm a full-time employee of Johns Hopkins University, so I've actually been on the faculty here for the last 9 years, but for the last 4 years, I've been the chief epidemiologist, and the salary support is about half and half. And the city has a contract with the university for my time, and actually the university, I would say, quote unquote, donates some of my time as well. So I spend about 90% of my time right now at the health department. And the university's funding is with that acknowledgement that most of my time is spent at the health department. Right now, I also advise students, and for a long time, I taught a course as well.
Thank you, Darcy. The next question wants to know how or when that you pitched the ideas of the faculty fellowship grants, specifically the Lipids and Bloomberg Awards, to your school donors to actually secure the funding for those programs. And the person is interested in who pitched the ideas, and did it take some back and forth and kind of insight into that process.
You can talk about the Lipids and the same thing. So this is Keisha, and I will say I run the school's Institute for Health and Social Policy, and we oversee the Lipids Awards. And I will say we benefited from a donor who was very interested in these translation activities. And I will say we have a phenomenal development office that stewards these relationships with donors who are interested in these activities. And it also involved me spending some time talking to that donor and helping him to understand the work that we're doing. And we've actually invited him to campus the last few years. And this past year, a few months ago, all of the recipients presented. And I think seeing the impacts that his funds are having really helped to excite him even more to continue to support these initiatives, just to see how important these funds are to support this kind of activity, which again is not often available through traditional NIH funding. And I think he really sees himself providing an important gap, and we're grateful for that continued support. So I'd say it's a combination of our development office recognizing somebody's interest and passion, putting faculty in front of that donor to help facilitate relationships and foster those relationships. And then I would just say that's really been important for us.
It was a very nice meeting this year with Mr. Lipids and all the faculty presenting a lot of enthusiasm, talking about what these relatively small grants really made possible. I think he felt like the money was well spent. I think it's a slightly different situation for the Bloomberg American Health Initiative, which is supported with a grant from Bloomberg Philanthropies, which has a not insignificant relationship with Mr. Bloomberg, who was the mayor of New York City, and as a mayor, really cared about moving the needle on actual public health problems. And so as we have funding from Bloomberg Philanthropies to work on public health problems, the idea of translation is very, very appealing to them. They really come at the funding in general from the perspective of how this is going to really make a difference. And so this is funding to make a difference. So it was very easy to sell to them because of their focus on results.
Great, thank you. And then as a follow-up, do the Lipids Awards include salary coverage for the faculty or only external costs?
The salary support can be provided with support from a department chair. So sort of your, what we call general fund support, there can be some negotiation where some of that can be sort of cost shared up. But most people do not use the funds for salary support. I would actually say of all of our current recipients, I don't think any of them are using it. They're using the funds really to support conducting research, hiring students, getting data, really using the funds to support the research to answer the policy questions that the policymakers and decision makers want the answers to. Again, a student support is really important in this as well. And I know Keith has a student on his project. Maybe you want to say what that student's doing, but I certainly know one of our current projects is really using most of the dollars to support, I think, 3 or 4 graduate students working on their study.
I'm fortunate in that my student's time is funded by a different fellowship, but she's very active on the grant, and our budget is 2 line items, printed materials and videography.
Yeah, well, I mean, I was going to say also for the translation, you know, there are things that cost money that faculty just have no access to funds to support that really don't take a huge amount of faculty time, but can have a huge impact in, engaging with communities and supporting the public sector. And so, for example, the online course on climate change and policymakers, you got to put that whole thing together. There are videos, there's, the software, there are all these different things that you have to do. They were really excited to do that, and then they have the resources that they can do.
Yeah, and that's a great example, Keith, about the funds for a videographer. I mean, how else would you find resources to pay for somebody to help make these videos that you're using to translate your research to the city and to other public officials?
It would have been a really tough sell.
Yeah.
Thank you for sharing that. The next question maybe is for Isaac. From a government or practice perspective, what practical tips do you have for others wanting to establish a relationship with academic counterparts, especially for working with students?
From what perspective? I'm sorry, I just want to clarify.
They said,
my perspective?
Yeah, sure, yours. Government or practice perspective, so your perspective.
Sure. I think that, I mean, just looking at the project that we collaborated with Josh and Johns Hopkins, I think that for us, really three things stood out. One, it was clear that Josh and his colleagues had the expertise to work on the particular issue that we were interested in addressing, which was the opioid crisis in this case. Two, they had a proven model that worked in other jurisdictions. And I think that was, again, as I said earlier, something that we took very seriously in agreeing to collaborate here, because we knew that if it worked in other jurisdictions, it had a higher likelihood working here rather than perhaps a new idea that didn't go through the political process or through really kind of the public forum, which is a dicey area and quite a big risk for us to take. And then the third, also something I didn't mention, is network. I think that Josh and his colleagues at Johns Hopkins School of Public Health had a network that they offered us that really connected us to national experts and even folks at various agencies in New York City and New York State that we hadn't really been connected to in the past. It's a large city, and so it's not uncommon to find that we perhaps don't have a regular relationship with the commissioner of the health department on the state level. And being able to make those connections for us was also something that made it a no-brainer to enter into that collaboration and get work started on addressing the crisis that we had locally.
Thank you, Isaac. The next question asks, how can we leverage the new CEPH competencies around cross-sector collaboration to advance some of these great examples?
Well, one way to do that, this is Josh, is to build in for academic credit courses that give credit for this kind of work. And so one example would be the course that Paulani talked about with the state senator who was asking some questions that had a lot of cross-sectoral implications. And the practicum, we think, can be broadened to include public sector engagements from a variety of different perspectives. One of our priorities moving forward, sort of under the Public Health 3.0 model, is to think about opportunities to do this beyond the health department and beyond narrowly, sort of traditional health issues. I think to some extent in some of the opioid work, we have been engaged in criminal justice issues, for example, like treatment and detention. But I think there's a lot more potential for that too. So as this moves forward, we want to really encourage faculty. I mean, you're doing agriculture policy. There are other kinds of sectors where we think that public health can be very helpful, and we really want to be helping these other sectors achieve really critical goals for themselves and for health.
Wonderful. This person asks, moving forward, do you see schools of public health being able to institutionalize funding that applies only to translational research projects? I guess get out your crystal ball. What are your thoughts on that?
Well, it has not occurred to us it has occurred to us, I should say, at an academic center that given that we're doing some of these things, that it would be worthwhile to study them and to show the impact that they're having. And as this happens, I think that's going to be important, because how you get something institutionalized is in part really establishing that, you know, there's a real return if you can invest in something. And, you know, you could conceivably imagine that as different funding streams are available to academic health departments, that this becomes, academic centers, that this becomes something that schools and programs do. So right now, it certainly has a lot to do with private philanthropy, but if we can build the evidence for that and the stories and really explain the value, then that may be something that ultimately there will be some more regular funding for as part of what we think of as a school or program of public health.
And this is Keisha. I would add, I strongly echo Josh's comments. I think the other side of that is making sure our students are also trained to help participate in those activities, and that our faculty are as well. I know there are many faculty who are interested in engaging in policy work, but who don't feel like they are ready or maybe have the skills to do that. So I think as hand in hand with institutionalizing funding for this work is supporting and training people to be able to effectively respond to these types of requests.
Sure. And then following up that, do your faculty members get quote unquote credit in terms of promotion and tenure for engagement in governmental and practice work?
Yes, the answer to that is yes. This is Josh, and one of my roles at the school is the Vice Dean for Public Health Practice and Community Engagement, and as part of that, our office has actually put together guidance on what excellence in public health practice means. Just like we say, you know, just because you publish a paper, if it's a terrible paper, that shouldn't necessarily help you with promotion. It's not just doing anything that should count for practice. And partly our view of what holds back consideration of those things is it's just really hard for traditional departments to be able to tell the difference between, oh, well, this person testified. This other person informed a strategy that reduced infant mortality, but it all seems the same to us, you know? And so we guidance for the departments at the school, which are really the engines for promotion here, for considering a practice in the promotion process, the academic advancement process, and particularly what constitutes excellence. So I wouldn't say that, you know, everybody is in complete agreement about what that means yet, but I think the conversation has really been joined. And I think, you know, for example, at the school, we now give practice awards for faculty for Baltimore-based practice. I think I'm looking at a winner here in Darcy, but also national practice, global practice. And so it's just elevating the profile of practice, and it adds up in the promotion process to an actual practice portfolio that people put together, and with the guidance that we give on how to be able to look at a practice portfolio and recognize excellence. That excellence in practice is really supposed to be weighted pretty heavily in the promotion process. So, you know, it's definitely a moving target, but my view is that it's moving in the right direction.
Great, thank you. I think we have time for one or two more questions. The next one, I think this is for maybe you, Josh, again. There is a misperception that academics are not interested in working in the community. And what do you think can be done to change or correct these misperceptions?
So, what was the first part of that question? I just want to make sure we got that.
Sure, that there is a misperception that academics are not interested in working in the community. That's the first part.
I think that you know, we have people here who do a lot of community work, and I've done some myself, you know, so maybe we can do a quick around the table here to how we go about changing that perception. Darcy, do you want to start?
Yeah, I think, so this is Darcy Phelan Emmerich. I think consistent work with the community and being able to follow through and attend meetings and be available, you know, on your community partner schedule, not just your own. But I know at the health department and here at the school, you know, really being a consistent partner and really showing up and listening, you know, lots and lots of listening, I think is really important.
I could definitely add to Darcy's comment about listening, but treating the relationship as a true two-way street. not only making contact when I have a need for my research project or my outreach, but also attending events that our partners put on and being a resource to them outside of the confines of the work that we've already specified that we do together. It really is a function of a strong relationship.
I think Darcy and Keith just gave great examples of how to have effective relationships with community. I would say one way to help sort of change perspective for me is, telling our story better. I know that there are a lot of people who do work in the community, but they don't even talk about it. And I think part of what we can do is to help change the narrative so that these types of activities are seen as common and seen as something that's a part of really the fabric of schools and programs of public health. The other thing I would say, because of the importance of scholarship, to the extent that we can tie these activities to scholarship, I think is also really important. I think about my own experiences where, we worked with a state legislator and actually published a few papers on those activities, even a couple with the legislator as a co-author. And so people who might not hear me talking about my activities at conferences would actually read the publications and reach out to me and say, I didn't realize you were doing that work. So I would say, let's change the narrative.
And I'll just add, this is Josh, to say that from the perspective of the school and the school administration, it can be challenging because for every faculty member who's a great listener, who has great partners and is doing great work, there may be someone else who, called very hurried up about a grant and kind of ruffled some feathers, and you can kind of understand why people were felt a little put upon. And our job is to have enough of a strong relationship in a system that they realize that that's just was a bad day for someone and it doesn't reflect the whole institution, and then people can call me up anytime. And I have good relationships with a lot of people, for example, in our city and the state, and if there's something that goes wrong, I want to know about it so I can jump in. So there's an institutional aspect to it in addition to the individual kind of faculty perspective.
Sure. Thank you for sharing your perspectives. And I think we have about 2 minutes left, so I think I'm going to go ahead and wrap up with having respect for everyone's time. But thank you to all of our presenters today. I think the question and answer part was very evident that this was a topic of high interest. So thank you again to our presenters. I want to remind everyone that this webinar is being recorded and it will be available in the archived webinar section later today. All registrants will receive an email notifying you that that is available tomorrow. And then just a few items of note, we do have other ASPPH Presents webinars coming up later this month. Please visit the events page and register. We also our registration is open for our ASPPH annual meeting and the undergraduate summit in March of this year. And lastly, our ASPPH and FAB sponsored academic and practice linkages in public health caucus is accepting abstracts for the 2019 APHA meeting taking place in Philadelphia in November. So please visit that page and submit your abstracts by February 19th. Thanks again to our presenters and have a wonderful rest of your day.
Thank you very much.